I'm Pamela Wu, and with me today is Dr. Brianna Winder-Patel, a clinical psychologist at our world-renowned Mind Institute. Mind, as we call it here, performs research on and provides care for neurodevelopmental disorders. Today we're going to be discussing how to help adults and children, both with and without neurodevelopmental disorders, in this time of coronavirus anxiety and lots of routine changes as well. Dr. Winder-Patel, thanks for being with us.
Thanks for having me.
Many of our viewers have been experiencing a lot of anxiety since the coronavirus began. What have you been seeing in your practice?
Yeah, so before we get started, I just want to mention that Dr. Meg Tudor is also a psychologist at Mind, and we work together on getting these materials ready, and then in this effort of, physical or social distancing, she wasn't able to come. So there's probably more things we're going to develop over the days to come about this, and she's kind of equally involved. So I wanted to mention that, and she has a similar practice to mine at Mind. What we're seeing is that, this is a time of high anxiety for a lot of people. What underlies anxiety is we think of, it has a lot to do with fear of uncertainty and worries about uncertainty. And obviously there's a lot of uncertainty for us at this time. So we would expect people to have some anxiety that's higher, and that's a way that we're sort of designed to look out for dangers. Some people are having some anxiety that's even excessive for what's going on. And we have, a mechanism called the fight, flight, or freeze mechanism that we all have for when we're in a true danger. And it's important for that to go off if like a bus is coming towards you or something like that. But it's not, we have that go off as like a false alarm sometimes, and I think that's happening some. So what we're seeing in our practice is some of the kids are talking about the coronavirus in ways where they're, pretty anxious about it, but actually some aren't as anxious as they usually are, because the things that make them anxious, like separating from their parents or interacting with peers, they're not doing right now. They're kind of at home in their safe space. It's a lot of transition to move to the video visits, so that's been part of what we're trying to work on to continue to provide care.
What can parents tell children who are anxious about the coronavirus?
Yeah, so we want children to have, specific fact-based information.
Yeah.
So there are a lot of myths kind of going around and information that can be really scary for kids. And it's, best to not completely keep them in the dark, but give them some information so they understand like the true, honest effort that their parent is giving to let them know about it. So for example, we would want kids to know things like, we would want them to understand that people have viruses all the time, and that the difference with this virus is that we don't want so many people to get it at once, so that the hospitals and the doctors are just too busy. So we're all really working hard to stay at home from school and home from work to give them the space they need to work on this virus. And for a lot of kids, that's kind of enough information. Obviously, it depends on their cognitive and language level. But it's not something we need to be talking about all day.
Yeah.
So, it can be provide some information, try to get in there and see if there's any myths the kids are walking around with, and then move on to something more fun and relaxing like movie or a family game.
So it's not just you sort of delivering this information to your child, but you said to sort of ask if they are thinking of anything that we know to be myths. So it's really like encouraging a discussion, and maybe would you ask a child, say, honey, what do you know about the coronavirus?
Yes, because we don't want to assume that they're having certain thoughts about it that they're not. I had one child actually convey to me that, and this is a child with autism, that the biggest worry was the visual image of what everyone's putting up there, that the coronavirus, the depiction of what the virus would actually look like.
Oh, the ball?
Yeah. So if you think about that ball, it is a scary looking ball with red pointy things coming out of it. In the child's fear wasn't about getting the virus or dying. The fear was about like, that thing looks really evil and I don't want that inside of my body. So their interpretation of what's going on related to this virus was a little bit different than what you would expect. And so you have to really see, what is your own child thinking about versus assuming that everybody's just worried about getting it, because that might not be it.
That's really interesting information that parents would want to tease out.
Yeah.
Well, since schools are closed and there is an important focus on the social distancing, which is why we're sitting not closer together, but we're sitting this far apart at this table right now, what would be helpful for parents to include in their daily routines with their kids being at home?
Yeah, so, since this is a time of uncertainty, we would want to be able to provide them with the most kind of structure and routine in ways that they're familiar with, so that they feel like they, know what's coming. So we would encourage parents to try to put some routine in place at home, like similar wake-up times, knowing when the meals are coming, knowing if schoolwork is expected at a certain time and when the fun time is going to come. We also, I'm hearing a lot of information about parents who are expected to work from home in addition to taking care of their children, in addition to teaching their children. And it's just so entirely unrealistic to put the pressure of some idealistic schedule on these families. So I think the idea is to try to keep some structure for the child, but also to be really flexible and kind of, easy on yourself, that's not going to happen in a perfect way every day, and we're expected to all do things that are really unfamiliar to us. It might be a time if the child is really struggling to do the traditional way of learning, maybe it's a time to focus on experiential learning. That's where we think of teaching them hands-on things, like how to measure the ingredients for, what they're making, or going outside for a walk and trying to identify trees or flowers that we know of. That type of learning is really important too. And parents are actually doing that a lot of the time. They might not realize that. And the other thing is to think about, are there things that you really loved as a child that were really meaningful, and maybe this is a time to do it. Like, I was a big fan of making forts and doing scavenger hunts and all of these things. And at the end of this, we want kids to be able to look back and not feel like, wow, that was so much tension the whole time.
Right.
We want it to be able to be like, well, it was kind of stressful for everyone, but I had some really great experiences with my family, and I learned, now I have some great memories. So it's a balance, and we have to be kind of easy on ourselves at this time.
That is such good advice. I think so many families need to hear that right now.
Yeah.
We've been talking about routine. You talked about sort of developing a flexible schedule because kids like to know what's coming. A lot of children and people, adults too, with neurodevelopmental disorders really thrive on routine. And for a lot of families, their home life has just been completely upended by this. So what are some of the special challenges for families who have a member of the family with a neurodevelopmental disorder?
Yeah. Well, I think the biggest one is that, in our world, in my field, we talk about we don't expect the parents to be the therapists. We expect if you need a therapist, you go to a therapist. And the same with parents being teachers. If you're not a teacher, that's a really big responsibility to put on a parent. And now, parents are everything.
Yeah, right.
Right now, for children with neurodevelopmental disorders that have in-home services that have been suspended, they're not getting that support they need, and they're not getting those therapists, and they're kind of meant to be the therapist and the teacher. So I think the challenges are that really the support. A lot of times individuals with neurodevelopmental disorders have a lot of extra therapies and interventions that aren't happening right now. So we would encourage parents to, keep with those strategies as they can, and see if there's other resources they can get through, if they have any option for video visits with a provider. And, there's a resource we're going to mention that the Mind Institute, faculty at the Mind Institute developed that might be helpful as well.
Yeah.
So I think the extra challenges are probably related to, really feeling like they were so used to that routine and what they did every day, going to school, going to therapy, and having trouble understanding, why is this so different and why don't we have a choice right now? So again, just kind of being supportive of them, trying to include things they really enjoy, include their special interests in their day. One thing we talk about is that if a child has a special interest in something, it could help you explain the pandemic to them. So for example, if they're really into superheroes, you could say, well, the healthcare workers are kind of like Iron Man, and their job right now is to go after this thing that they're trying to, fight against. And we need to give them the space to do that. And, eventually, Iron Man defeats the Mandarin, just like we're helping the healthcare workers defeat the virus. So sometimes pulling in their special interest can give them feel like they have some control and some better understanding. But it's really just about trying to keep the routine the same, but also being understanding that, that's a huge expectation.
Absolutely. You mentioned that sometimes kids might not be as scared as we think they are because we're so immersed in the news, and so there is a lot of fear among adults, but kids might not be as scared. For kids who are scared, though, like the one that you said was scared of the scary red ball entering his body, what can parents do to support those kids and give them a feeling of security?
Yeah, great question. So one of the things that we think about with thoughts, if we're having a lot of what if thoughts, that's usually a sign it's an anxious thought, because we're asking like, what if the bad thing happens? And we don't know yet because it's uncertain, it's in the future. So if you're hearing a lot of what if thoughts from the child, it's a tendency for parents to just say like, oh, don't worry, or it'll be okay. But for some kids, that reassurance doesn't work. And part of why that doesn't work is because they have this thought and it's not going away. So we have a strategy of getting the child to look for proof for their thoughts. So, if your thought is, what if I'm going to get very sick and die? Looking for proof would be saying things like, oh, is anyone in my house sick? Are we responsible with the physical distancing, that we're doing? Are we washing our hands? Do I have any proof that I'm actually in a true danger right now? And if that proof isn't there, then we have to question, is anxiety telling us the truth? So we talk about externalizing the anxiety and being able to decide whether to listen to it or not. So if you look for proof and you realize you don't really have any, that the anxiety is telling you the truth, then we encourage children and adults to do something called change the channel in your mind, just what we call it. So we teach little kids, your mind is like a TV, and if you're kind of stuck on the anxiety channel and it's not helpful for you, we have to kind of let that channel go and switch it over to something that's calming or relaxing. This week was like, I need to find something personally to change my channel. And so I found the book called Joyful. It's about, looking around in the physical world and understanding how it impacts inner joy. So if I'm having these thoughts that are not helpful right now, I change my channel to either thinking about the ideas in the book, or even like if I can take a break, going and listening to it. I may or may not have been hiding in my closet listening to it last night.
Change it to the joyful channel.
Right. So it's, things like this that adults need to implement too, because we have the worries as well, but we also have, many of us, the responsibility of taking care of our children.
Yeah. That leads me actually to my next question. How important is it for adults to sort of model this calm behavior for kids? Because I feel like they really pick up on our energy that way if we're really anxious.
Yeah. They do. They're just little investigators. They're very observant and aware, more than what we often realize. And I think that there's specific ways they could model some of these skills right now. We think a lot about how problem solving is helpful. So if you have a problem and it can be solved, you're going to feel less anxious. So an example would be if a parent is trying to switch over a doctor's appointment or a class to a video visit, and they can do that, they could model for the child, oh, mommy had this problem, we're not able to go to the visit, so here's what I did to problem solve it, and wow, I feel better now that I did that. If you can't problem solve something, really the other option is to cope with it in healthy ways. So again, like, try to switch over the video to a video visit, it didn't work. Well, I did what I could, and now I just need to change my channel to either listening to music or playing a game with the family, because it's not going to help me to keep worrying about that. So that's something, that parents can model, and really this idea of problem solve something when you can and cope in healthy ways when you can't is probably helpful for all of us right now.
Yeah.
And so it's something that parents, you know, can model when they can for their children, but also realize that, again, they're not going to be the perfect teacher and therapist and everything right now, because we just think that's unrealistic.
What additional challenges might there be for people with autism or other neurodevelopmental disorders that we haven't talked about yet?
I think that, you know, the one that I mentioned is that piece about some individuals with autism have heightened visual abilities and visual memory. So this piece about, you know, that child seeing that image of the, you know, the way they're depicting the virus looking really stuck with him. And maybe not in a way that it would stick with other people. So we have to be careful of what they're being exposed to right now, because it's just a lot of information that's confusing. And the both on the side of the visual stuff can be difficult for them, because if that's something that gets stuck in their mind, it can be hard to shift off of it. On the other hand, you know, you can do things to help support the visual strengths right now, like having children draw how they're feeling rather than talking to them about it. That's something that we do a lot in therapy with kids with autism to, you know, get their perspectives on how they're doing. The other things, it's sort of just depends on the child. There's actually an area of anxiety that we're researching at the Mind Institute. It was developed by a psychologist named Connor Kearns, and it's called fear of change, and it's something that we see more often in kids with autism. So it's this idea of being anxious about change in routines or change in schedules. So the kids that were already having difficulty in that area are probably really struggling right now. They probably never had an experience in their life where their schedule has changed to such an extreme degree.
Yeah.
And you know, parents have to just do their best to make them comfortable and help them cope and help them find things that will reduce their anxiety, like providing a visual schedule for them at home, you know, that's reasonable, and help supporting them in those ways.
When is it time, at what point should someone go see a professional when their anxiety has gotten the best of them?
So we have in the one interview we do, we talk about when anxiety gets turned on like a light switch and you can no longer turn it off, is where you're kind of hitting that point of thinking, wow, this is at that level that we might really need to do something about it. And if in the other concept that we think a lot about is interference. So if you just get anxious and you kind of think about it, your parent gives you reassurance and you feel better, that's one thing. But if you get anxious and then, you know, you can't even get on the phone to talk to grandma because you're so anxious, and you can't even, you know, walk outside because you're so anxious. It's that level of interference that often makes the decision of, like, is this to that problem point that we'd really need to seek care? I think what's going on right now is that it's more typical than not to feel some anxiety, you know, so we would want to, you know, help support kids during this time and then see once this calms down, is the anxiety still staying high, and to help them seek support if so.
We're not supposed to leave our homes right now unless we are on essential business or running an essential errand. You can still see a provider here at UC Davis Health without having to leave your home. Can you talk to us about video visits and how many more video visits you've been seeing?
Yeah, so we, because we're not seeing patients in person, our staff in the Mind Institute and also in psychiatry worked really hard to get everything transferred over to video visits. It's a way of doing telehealth that we can do through MyChart. And so all of my therapy patients have been transferred over. It's a little bit strange at first, you know, I see some little kids and they're sort of, my big head pops up on the screen and they're like, oh.
Right on their tablet or their iPhone at home.
Right. Yeah, they're like in their bed or whatever.
Right.
And so parents have been great about like supporting them and do you want me to stay here? Because often, you know, I have a portion of the session with the child just alone. So again, it's that idea of flexibility. We have to do a lot of things that don't feel like our usual way of doing things. And most of them have been really great. And the patients that I'm I've been underway with treatment and we're in the middle of it. We already have goals we're setting, they understand the format. It's just that they're sitting at home rather than being in person. Anxiety therapy has a big focus on what we call exposures. So it's about facing the things you're scared of. And Dr. Meg Tudor and I do a lot of these exposures with patients when they come in. So that's a little tricky because we would do the exposures with the patient first, like a child who's, very, very scared of germs and doesn't want to touch doorknobs. We would work with them and encourage them, to touch a doorknob with us.
Yeah.
So if they're not with us in person, we are being creative about how much we can ask the parents to do at home and how we can still get that really important part of therapy addressed. But we feel like at the very least, if we can be supportive and continue to work on our goals, that will be one part of consistency in their lives right now.
Yeah. For those of you who are interested in learning more about video visits, you can contact UC Davis Health, contact your provider at UC Davis Health. You can find instructions online on how to do it as well, and through what we call My UC Davis Online. It's the app, or our providers call it My Chart. So you can learn more that way. It's a really, really great resource. Let's keep talking about resources. You are involved in something called the STAR study.
Yes, so the STAR study is, it stands for Specifying and Treating Anxiety in Autism Research. So it's specific to kids 8 to 14 years old who have autism and have significant anxiety. So right now there's, a lot of anxiety going on, and in a lot of people that'll probably go down when this gets better. Yeah. For kids that we're looking for this study, it would be kids who have more higher level of anxiety that's kind of persisting, and we have this treatment study. So the study is that if they qualified for this, the screening criteria, they would be randomized to either cognitive behavioral therapy or medication group, which is sertraline, or a pill placebo group. And they would see us in the office. The main part of the study is 16 weeks, and then there's follow-ups. So we right now, since we're not seeing people in person, we aren't doing starting any of the visits, but we are doing this phone screens, and we're trying to, capture information on families that would be interested now, and then we would be able to bring them in when it was safer. So if people are interested in that study, the contact person is Taryn Heckers, and her phone number is 916-703-0119.
So if you're interested, you can learn more. That can be available to you.
Okay,
great.
Yeah, that's great.
Mind has a new web platform too that contains resources for families and caregivers of kids with autism, and it's really excellent for shelter-in-place time.
Yes. It is called helpisinyourhands.org. So that's actually the website, helpisinyourhands.org. And it's a free website that was developed by Drs. Aubin Stamer and Sally Rogers at the Mind Institute. And it was developed to help caregivers with skills to assist them in working with their children with autism. So it's based on the Early Start Denver model, which is something that's the model they've been working on and researching for a long time.
Is that the early intervention?
Yes. So this is targeted towards children who are like 0 to 3 years of age, very young children. And the website has these video modules that can kind of show you how you could work on some of these skills with your child with autism or showing signs of autism. And I signed up on it today to take a thorough look. It's very easy to sign up. It can be used on, I believe, iPhones, iPads, lots of devices, and again, it's completely free.
Is there anything else that you'd like to add for our viewers who are dealing with anxiety, sheltering in place?
Yeah, I mean, one other resource that, I don't know if we'll be able to post, but Dr. Pakarak is our division chief of child and adolescent psychiatry. And he was interviewed by KCRA on how psychiatry is handling this as well. I think similar to us with switching to these video visits. And I think other things are really there's the lovely part of social media right now is that parents are posting a lot of really creative things that people can do with their kids at home. Some examples I've seen are, I mentioned my favorites of my scavenger hunts and my forts, but there's a website where celebrities will read books to your children. There's another website where a famous children's author will do a doodle and it's kind of, he's doing it kind of live and your children can do it. And there's zoos that are showing animals. So we don't want people to, slip into doing a massive amount of screen time because we want kids to get physical activity and to get these productive activities. But there's been some pretty creative ways set up for children to access, learning and maybe have some time on screens that could be really fun and really unique.
And productive and comforting to kids and parents alike.
Yes.
So someone asked that their granddaughter's anxiety is surfacing in the way of controlling behavior regarding her classwork. Do you have any suggestions on how this person can help their granddaughter prime in order to be ready to do classwork at home versus in the classroom?
So, I think one thing that can be helpful is before classwork has started to bring right before it an activity that's likely to be more relaxing or settling. So, depending on what options you have within the boundaries of your house, but swinging on a swing or jumping on a trampoline or doing something physical like that to kind of calm the body and mind and get it ready for the work. The other thing is maybe it's just confusing what's expected at home, or the work times are a little bit longer than what the child's used to. So maybe starting out with just doing like a few problems and saying we do a couple minutes and then we take a break and we get a fun reward to help start this, new process that she's probably not used to doing.
So really, it's just a time of change for everyone.
Yes.
And your message of flexibility, I think, is so important.
Yeah, and you can even get really specific about flexibility. So I've talked to a few kids on my video visits this week about, do you know what flexibility means? And a couple of them were like, nope.
Right.
I'm like, well, it means, when there's something that we're used to doing one way and we really are encouraged to do it another way, to sort of be willing to try, for the sake of maybe yourself or the family. So you can even say to kids, like, something I might say is, well, this morning I had to be flexible when my child was like tapping on my face and asking me to sing Old MacDonald before it was wake up time.
How fun for you.
So I was flexible this morning. So now I'm asking you to, sit down and do this, or, eat your lunch at a time you're not used to. Let's see if you can get some flexibility points. And you can, reinforce them by giving them points for it and making it kind of like a game, like who can be the most flexible today. Because I think that's so much of this, adapting and being flexible is just not something where, kids are like really used to working on.
Yes.
And so if we explicitly describe it to them and then give them a chance to try it, that might help as well.
For more coronavirus information from our reliable sources here at UC Davis Health, please visit health.ucdavis.edu/coronavirus. Thanks again for being with us.